Respected elders, thank you for coming over here. Thank you, Kunalji, Rajigar, thank you for coming over here. My name is Anand. I'm the Secretary and Trustee of Sri Sathya Sai Annapoorna Trust, predominantly focused on nutrition space, but we also have our dignitaries on the healthcare and education space with us. I take this opportunity to share a couple of incidents which have happened in my 7 days of tour to Telangana. All of us know that when we do good, we should also make it uh, like we should make it available for people to know it. Awareness needs to be created. The 7 days of being in Telangana actually helped us to connect to many of the people over here who have come. 50 to 60% of the people we have personally invited to be a part of the program, and I'm very thankful to all of you for being a part of this session. Yesterday was a very touching moment and an emotional moment to me, and I was sharing this with one of my dear friend. After all these 6 days of work, whatever we are doing, going to various places, we ended up in our Yusuf Kuda's Shishu Mandir. And this Shishu Mandir was for the abandoned, surrendered children. I saw 2 months old child, and I saw 10-year-old girl, and I saw a 20-year-old student. For whatever reason, we've been kind of meeting, and we are on the work front being to do whatever needs to be done. For the 2 minutes of meeting this small 2 years old girl, and I have my friend over here, Pradeep, we both of us experienced bliss. We don't know who is this girl. And we just went, and she was looking at us. She was curious. Naturally, she wanted to speak to us. So I asked her to come. She came. And she was not even able to speak. And I asked her, what did you have? She said she had some food. And automatically something inside told me I need to give a hug to this girl. See, this is what is actual love which we all pray to God, because loving our dear ones is definitely the case for all of us. But loving somebody whom we don't know and we go and meet them, it really opens our eyes. And when I came out, it encouraged me much more that we should do even more for these children. And I also invite all of you to make it a point to go to one Sishu Mandir and definitely make it a point to just bless all these children. The second incident is this event which was conceived was a 4 days planning event. So my apologies for any inconvenience over here. We had about 20 of our very strongly knitted family of volunteers, and they all came forward with this idea. And everybody whomsoever you're here, it's because of one of the volunteers who have actually been a part of inviting you over here. So I thank the entire team which has been part of this session, and a big round of applause also if you can. So I think I'll just not take much time. Just to give you a small background, I come from IT industry, worked for about 15 years in IT space, and after that I kind of started doing this nutrition program every day morning, taking some breakfast for school going children, especially in the rural villages. So the itinerary of my plan was every day morning get up at 6:30, pick up some breakfast item for about 30 children, put it in my car, go to the village 20 kilometers away from my place, which is in the south of Bangalore, finish the service, have my breakfast also with them, sit with them, have my breakfast. From there, come back to Hyderabad, which is the north of Bangalore, Manita Tech Park. I was working for one of the IT MNC there. Finish my work 40 kilometers from there, and come back to home, which is 20 kilometers again. So 80 kilometers is the travel which I was doing every day. And there was never something like an effort. It's an effortless thing. because I feel, I'm connected to the children when I go and give them some upma. Because when I go back and work now, your mind is constantly thinking about them. There's a divine bliss that I did something good for those children today. And then I started telling to my friends, would you like to experience something like a happiness? Would you like to experience it? I said, yeah, why not? I mean, they were curious. I said, please come with me. So I picked up a couple of my friends. I have my dear trustee over here, Sai Prasad. He is also he's also coming from an IT background, and he's a director, ex-director, but he is now full-time taken up work with Annapoorna. And we went and showed them what we did. This time we took some chocolates and some bananas because somebody's birthday was there. And it was a wonderful experience. It so happened that whenever we go, they will just ask us, Anna, what are you going to get tomorrow? So it's like, if your son or a child, a daughter comes and asks, what is there for breakfast for tomorrow? You are so interested to do something for them. Then we say we get puri and aloo, or dosa and chutney. And sometimes they will come and ask us, Anna, can you get some chocolates or something else? So that's where the bliss was for us. I was connected to those children, and it helped me a lot at a professional front. Sumanji, you know it, at a professional front, how we have to go through so many pressures. There's so much of things we go through in our day-to-day interactions, people management. Kunal spoke at length about how he has to balance between life and also at the same time being a part of the society. Everybody goes through that kind of transitions. And here is an opportunity. I felt the shortcut to this is just be a responsible citizen doing some selfless work. Now, I am not saying that we are doing something great and we want you to follow us. Everybody in our own capacity are doing it. I'm just sharing my experience. I felt much more connected to this system. And in the process, more people joined. Then one after the other, from Infosys, Tech Mahindra, Wipro, because we come from the IT industry, we have gathered more and more people. Later on, Narasimha Reddy Garu, even including Dilraju Garu, in his own place in Nizamabad, we do breakfast program. So we ensure that we take people together. It's not about doing, but doing in a right, organized way. So what we did, we took the permission of the government, we took the permission from the local panchayats, and we ourselves together did this program. But apart from that, if you get to see, this is a slide which speaks about the educational campuses. We have spoken about it. I would personally request all of you to visit one of our educational campus, which is about 1.5 hours from here, Siddipet campus, Sri Sathya Sai Annapoorna. Please have a look at the students over there. You will see the change in them, the way they kind of, take care of the entire the school itself. You can definitely see it's a residential campus. Please, I request all of you to come. And we have also spoken about the hospitals, right? The pediatric cardiac care hospitals. I have a small story to tell, which will actually intertwine with this pediatric cardiac care hospital. If you see the current state of the malnutrition in India, and if you see the current global hunger index of India, we are rated at 101 out of 113 countries. And malnutrition as such is definitely a very painstaking thing for us to discuss in here in this forum as well. Now, yes, it's there. So there are two things to look at it. One is the preventive kind of a thing and the corrective kind of a thing. What you saw the hospitals, what you see the educational campuses are all corrective things, right? In a hospital itself, something happens to us, it's like a corrective kind of a thing. We are trying to formulate something out of it. Puberty age. If you can take care of the girl, giving the right nutrition, giving the right platform of education, later she gets married. After getting married, if she is delivering a baby boy or a baby girl, definitely he will be healthy. And if he is healthy, the mother need not take him to some hardcore hospitals like this, where a 35 kg woman delivers a 2 kg boy. What will you anticipate out of it? Naturally, you will have some congenital heart disease, some hole in the heart. The wait list in this hospitals is, at this point of time, every day 200. Or it might be even more. That too because whatever we are able to convey the message that there is so and so super specialty hospital. Imagine if we had a wide, publicity happening, you would be seeing much more lined up over there. So that could be one of the reasons we are now starting the preventive care, where we are focusing more on the girl children who can definitely help in building the nation with the right, strong, healthy generation of either boys or girls, etc., etc. So with that as a platform, we are here now. Tomorrow, people might ask me, it's understandable you are doing this. What is it for me in this? Naturally, all of us are here. What is it for me in this? There are 4 things which I would like to tell before I conclude this small session from my end. First, like what I always take Narasimha Reddy who is also here, and Rajikar also. Please identify any 3 or 4 schools or even 1 school in your vicinity, and please tell us. We will adopt that particular school and start breakfast. A simple banana, a simple milk, a simple chocolate or something else we will adopt, and we will start the breakfast program, and we will also like to make you involved in that particular activity. So you have the involvement of people like us, you have the involvement of NGOs, and we also have the involvement of the government. That is number 1. Number 2, if you come across, I'm sure you come across, really deserving, needy children who need a platform for better education, look no further. You can always reach out to us. From 6th grade onwards, all the way till post-graduation and PhD, we provide absolutely free education to these children. No caste, no religion, nothing actually is applied over there. Now, we have a private university which takes care of the graduation and post-graduation and PhD. We have one of our Chief Administrative Officer from the university has attended the session over here. Now, that apart, now where are these campuses located? These are not actually located in the cities. They are actually located in the rural hinterlands. Siddipet itself is pretty much away from Hyderabad, right? So, like that, we have all these schools in the rural hinterlands, which is helping us to take those rural children to come and join. If you're putting a school in a city, it doesn't really make a difference. So we are establishing ourselves to be over there. And then the third, which I'm again requesting to all of you is, anywhere you feel that there is a sign of a child having a murmur in the heart, some maid comes and says, my child is having a murmur in the heart. It's a serious case. You may not know it. That means the child is about to die. This is not my statement, a statement given by the pediatric doctors. They may not know. If you find anything of that sort, please refer them to our hospitals. Sri Sathya Sai Hospital. We will share our contact numbers, and also kindly spread the message to wherever you feel like you can make an experience. And lastly, okay, if this all is what is a part of our agenda to be a part of this program. I personally feel all of us, every one of us have a responsibility to take up. And in our own small way, what we are doing is, we are trying to work on providing micronutrient health supplements. You have seen something called a Sai Shiur over here. The supplements which are needed for growing children. That is something we are trying to give it to many of the elders, even to the children, growing children, pregnant women. We have seen the videos on them. And I am very thankful to some of the people over here, Mr. Gauravji, who is also helping us to set up these facilities where we can manufacture micronutrient supplements and give it to the doorstep of the rural villages. You have heard of Proteinex. Proteinex as such is costing 1 kg at 600 or 700 rupees, and half a kg is 350 rupees. Similar formulation of Proteinex is what we get it done and we give it to rural communities. And how we use our nodal centers, we have campuses in all the 27, 28 districts in Karnataka. We use them as nodal centers and we do our work. So net to net, we have a platform. It's an absolute platform available for all of us, for every one of us, to see if we can use this as a platform. And we can make more and more people aware. And you on your own want to do something, then definitely you can look at these various programs which are there. Now, to summarize, if a girl child is given the right nutrition and the right education and also has the right health care, it will end in getting, I mean, of course, I'm not speaking about the early marriage, but definitely that can be also covered. And later on, after getting married, the boy who comes will be healthy. And that will make as a cycle for us to have a healthy nation. Somebody in the government side asked me, or in fact I only positioned it. I said, sir, we have this 5 rupees. 1 5 rupees can make a difference to one child. So somebody asked me, how is it possible? Sir, 5 rupees के लिए हमको दूध मिलेगा, नहीं तो बनाना मिलेगा, नहीं तो you get micronutrient supplement like साइशो, नहीं तो breakfast भी मिलेगा. हर दिन बच्चे को you give this 5 rupees of breakfast, you can save 50,000 crores of healthcare budgets which we are planning to do. Very simple projects like this, we might take for granted, but they have a very high impact. So with this, I wanted to share these case studies, and we would love to have one-on-one discussions with all of you and see how we can work together. And also we look for your guidance. It's not that we are always on the right side of it. You can always share your wonderful experience and tell us where we are going wrong or where do you think we can improve, and we can conduct such forums in the coming times. I thank once again all of you for being over here, and we wish to see you soon, sometime later. I personally would like to request Dilraji Garu to share his experience to all of us before we go back to Kunal. Thank you.